Hi, everybody. We have a very special guest this afternoon.
My name is Podiatrist Kelly, and I'm a podiatrist in Las Vegas. A little bit about me. I've been in practice for 26 years. 21 years of it was in the Bay Area and 5 years in Las Vegas, Nevada. I have training in surgery, and also I have a fellowship in diabetic foot care. That has always been my interest. The way I conduct my practices is prevention. I like to get ahead of problems before they occur. So most of my practice, especially with my diabetic patients, is about education and to make sure that they understand how they can prevent problems from happening to begin with.
Awesome. Thank you. Dr. Kelly is my podiatrist, and we're here today to talk about how diabetics should take care of their feet. So, Dr. Kelly, when should diabetics see a podiatrist?
When a person is diagnosed, has a formal diagnosis of diabetes, regardless of their complications, they should see a podiatrist, just like when they are told that they should see an ophthalmologist for their eyes, maybe a cardiologist for their heart. They should also add a podiatrist to their list, and that should be at least one initial evaluation to discuss their risks.
Would you also at that time do a neuropathy test?
During their first visit, this is the job of a podiatrist to do all the exams, vascular, neurological, and just skin check, musculoskeletal, balance, just to do all the tests to make sure, A, the person is okay, B, if the person is deficient in one of the issues, then the person gets counseled on how to remedy it.
So, how many of your patients have diabetes?
Gosh, well, I've been in practice for 26 years, and over the years, I have seen a steady increase in the number of diabetic patients. I would say anecdotally, more than 60 to 70 patients of my patients have some sort of a diabetes diagnosis, whether they're considered pre-diabetic or they are diabetic and well controlled, or diabetic with some sort of a neurological or vascular manifestation.
So it's currently 60 to 70%?
I would say in my demographics, I would say more than 60 to 70%.
Wow. What was it when you started years ago?
Gosh, back then it was probably 25 to 30%.
Wow.
Yes.
Massive increase.
Yes.
So what are the common issues you see?
Well, when a person is diabetic, we have to kind of take it through the different systems. You have to understand that diabetes isn't just the sugar is up and you need to control that or you need to manage your insulin. Diabetes will manifest itself in different organs and different parts of the body in a different ways. So when it comes to patients' feet, sometimes patients don't know that they have diabetes, and through the history, we find out, and just looking and examining, there are signs that it tells me that they may be diabetic, and then we do check them, and sometimes they are, and sometimes they aren't. These are undiagnosed diabetes. So what do I see that makes me think that this person might be diabetic? Skin and nails are the first things that I see. There are changes in the texture of the skin. The skin becomes maybe discolored, or it looks like that there is this general dryness of the skin, or the nails become yellow and thick. Of course, the first thing that we say is, oh, this is just fungus. Well, what is the reason for the nail to become thick and discolored with fungus in diabetic patients? So these are the signs. Lack of hair on toes and feet and ankles is another telltale sign that the person might have some sort of a underlying problem, including diabetes. And so from the skin to the circulation, maybe a lack of a pulse, all of those are things that we see in a diabetic patient. The major one is what we call neuropathy, which is basically the nerve damage. And the nerve damage comes when the sugar is just too high in the circulation, and those nerves get damaged by high sugar, and the person starts to experience symptoms like, oh, I have a little bit of a stabbing pain in my feet at night, or I get a tingling feeling, or I feel like there is almost like ants crawling on my skin. And these are the early signs of neuropathy. And if they are unrecognized and the person goes on with their lives without having the sugar addressed, that will lead, I mean, if you're lucky, that will lead to numbness. And in some cases, in unfortunate cases, that those symptoms get exacerbated and the person constantly feels the burning sensation, and that becomes really, really painful. Mm-hmm. So that's what a neuropathy is. Again, it's an umbrella term for a nerve that gets diseased, and in diabetic patients, it's because of the sugar being too high.
So how do you treat it?
Well, neuropathy is a manifestation. It all goes back to the sugar.
Sugar?
Absolutely. So controlling let me back up. I think to recognize the problem first, and then understanding that sugar is the cause, recognizing the problem early on, and realizing sugar is the cause, bringing the sugar down will make a huge difference in the outcome of neuropathy. If you do it early on, you can reverse the neuropathy. I've seen it with some patients. So that's the number one. And then we do have many ways to attend to the symptoms with supplements that they're meant to help the nerves. There are a lot of devices that are being used for neuropathy, like laser, some injections. But again, to be a thorough as far as neuropathy, you have to address the actual cause, and that is lowering the glucose.
Okay. So that's the absolute number one thing.
That's an absolute number one, yes.
Does footwear help?
Footwear help for what? Neuropathy?
Neuropathy, yeah.
Well, footwear is a very important part of neuropathy care. And what I mean is that if you have neuropathy, if you are unable to feel your feet, if you are not, the sensation in bottom of your feet are not brisk, then yes, you do need to have a protective shoe. Neuropathy itself is not being helped. The shoe is only a device to prevent trauma to the bottom of your feet because of the neuropathy. So if you can't feel the bottom of your feet, you do not want to walk barefoot. If you cannot feel the bottom of your feet, you do not want to go on a hike in a very thin sole shoe, because you cannot feel the rocks on the bottom, and you can injure your feet, and that's going to be a problem. So yes, shoes are important. They don't necessarily help the neuropathy, but they protect the bottom of your feet from injuries because of neuropathy.
So would sandals be okay?
Yes and no. If you're diabetic and you can feel the bottom of your feet and you have not been diagnosed with neuropathy because you're doing a good job of taking care of your sugar, yeah, sandals are somewhat okay. But sandals are not meant to be walked in a long distance. They're meant to just go from point A to point B, short distance, for your convenience around the house. These days we have a lot of sandals that they have a lot of padding. Also understand, sandals are open. They don't protect your toes. If you don't have neuropathy, but your circulation is compromised because of diabetes, what's going to happen is that if you wear a sandal and you injure your feet, your toes, well, now the poor circulation is going to get you. And that's another problem with diabetic patients. Circulation is compromised, and that is something that you need to protect your feet from injury. Yeah.
Got it. So that makes a lot of sense. I have a question, though. How do you know you don't have feeling in your feet? If you don't feel anything, how do you know that there's a problem?
So this is why it's so important for diabetic patients to have their initial evaluation with their podiatrist.
Got it.
Through the exams, we know what kind of a risk this patient has. And through that consultation, that we are able to teach our patients how to protect themselves. If we diagnose them as someone who is neuropathic and they cannot feel the bottom of their feet, our job is to teach them how to check their feet on regular basis. So if there is a problem, they understand it quickly and they seek out treatment rather than waiting a week or two when by then it's too late.
So is keeping the feet moisturized a good way to help?
If you have diabetes with a skin manifestation, which means the skin is kind of has a brown patches, that suppleness has gone down, the skin is dry looking, yes, you want to keep your skin moisturized to keep it nice and supple and maintain the integrity of your skin. If you don't do that, the skin is going to be prone to cuts and fissures, and that dryness is basically will allow any slightest injury to open up your skin and cause problem. And when you do the moisturizing of your feet and your legs, you always want to avoid putting cream between your toes. This is one of the areas that we always advise our patients. Please don't put anything between the toes because it's a close quarter, and putting a moisture is an environment for bacteria and fungus to grow. So the first rule is, yes, do the moisturizing of the feet, but always keep between your toes dry. As a matter of fact, when patients come out of their shower, we suggest that they kind of floss between their toes to keep it dry. And if they can't reach, they can always use a blow dryer on a cool setting, and dry between their toes to make sure that that moisture is evaporated.
Mm-hmm.
So,
if you find this information useful, give us a like, subscribe to the channel, and tell your friends about us.